Come in. Hi, my name is Mary and I will be your nurse today. And first off, can I get your name, please, and your date of birth? She states that her name is Jane Doe and her birthday is January 1st of 2000. All right, awesome, Jane. Let me just check your wrist here. Okay, perfect. Everything matches up. Okay, so what I'm here to do today is do just a quick head-to-toe assessment on you, make sure that everything's checking out okay with you and baby. Sound good? She just says sounds good. Okay, so first off, I'm going to get some privacy for us. And so if you would like your family member to stay here, that's totally fine. I see your mom is here. Nope, she asks if mom would leave the room. Okay, so I politely ask mom to leave the room and just tell her we'll be a few minutes. Okay, so now let me close these curtains. Alrighty, now that we've got some privacy, I'm going to go wash my hands and I'll get right back to you. Wash. Okay. Let me just put some gloves on here, Jane. So first off, how are you feeling today? She states that she's feeling okay. A little anxious to get home with baby. I don't blame you one bit. I bet you want to get home. Okay, so first off, what we're going to do is just take some quick vitals. We're going to do temperature, blood pressure, respirations, all of that. Okay, so first off, let's check your respirations. Just real quick here. I'm going to do some heart sounds too. So it's okay if I open up your robe here? She says yes. Okay, so let me open up here. Sounds good. Other side. Take a couple deep breaths for me. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, Jane, now we're just going to check out those heart sounds. I'm just going to reach underneath your shirt here a little bit and be real quick about it, okay? Listening. 8 to man. And a full minute at the apical. Alrighty. Now let me just check your radial pulse. Check for a full minute. It's 86 compared with the apical. They're even. Okay. Now I just want to get your blood pressure here. Okay, blood pressure real quick. Very good. So 110/86, perfect. Okay, and now let's just get your temperature. Do a forehead. 98.9, perfect. Okay, and respirations of 20. Very good. Okay, so Jane, are you having any pain today? A little bit of pain? Okay, can you tell me where it's at? Okay, in the vaginal area. All right, well, that makes sense. You just had baby. Can you tell me on a scale of 1 to 10 about how bad it is, how good it is? 1 being the best, 10 being the worst? Just about a 2 out of 10? Okay, okay. Is there anything that you're doing that's making it worse? Just moving around a little bit? Okay. Alrighty, well, you know what? I'm going to get some ibuprofen for you here after we're done doing this assessment. Sound good? Okay, perfect. Okay, so next I just want to do a real quick neuro exam. Just going to make sure that your eyes are focusing all right. Sometimes after pregnancy, women have a few eye issues that are temporary, but I just want to quick check you out. Sound good? She sounds good. Take my pen light, follow the light. Down here. Move just the eyes. Okay. Now I just want to check your pupils, okay? Okay, perfect. Eyes are Perla. Okay, are you having any headaches at all today, Jane, at all? Just a small, dull headache? Okay, sounds good. Well, you know what? We're definitely going to make sure that you get up on your water intake. I'm going to stay up on that, and that ibuprofen should help a little bit about with that too. Okay, so how's everything going emotionally? I know that sometimes moms have a little bit of anxiety after having a baby, and we just want to make sure that you are feeling secure and calm about everything. And is there anything that you want to talk about or anything that I can help you with? Just feeling a little bit of anxiety about breastfeeding. Okay, well, you know what? That's fine. We're gonna have a lactation nurse come in and talk to you, and she is just a pro about these things, and she will let you know everything that you need to know about breastfeeding, so you feel really confident about that. Okay? Okay. Awesome. Okay, Jane. So now, if you don't mind, I'd actually like to take a look at your breasts. Just want to look at the size and shape of them, make sure that we're not feeling any hard masses or any abscesses, make sure that your nipples are looking okay. Is that all right? Okay, let's see. So let me just check this side first. Looks good. Not feeling any bumps. I see your nipples are a little bit dry. Let me cover up this one. Check here. Feeling. I see you have a slight crack in your nipple here. Is that causing any pain? Just a little bit? Okay, well, you know what? We're going to get some lanolin for that, and it'll help moisturize your breasts and keep them, the skin more intact on them through all this breastfeeding. Okay, now let's just cover you up for 1 second, okay? Okay, so I know that you said that you were interested in breastfeeding, but you're having a little bit of anxiety about that. So I just want to recap. We're going to get that lactation nurse for you. We're going to get some lanolin done for those breasts and some ibuprofen for the small pain that you're having. Okay, so next I would like to check out your bladder area and also your incision from the C-section. Would that be okay? Okay, awesome. So first off, are you having to go to the bathroom right now or anything? No. Okay, awesome. And when was the last time that you went to the bathroom, urinated? Was that about 3 hours ago? Okay, awesome. And I see in the notes it was about 100 milliliters of fluid. Okay, sounds good. That makes sense for about 3 hours time of waiting. Okay, so let's just check it out. I'm going to open up your robe here. Let's keep you covered up down here for now. We'll check that out later. Okay, so just checking out the incision. I see the original dressing was already taken off. I don't see any edema. There's slight bruising, which makes sense. That will go away soon. How is the pain in this area here right now? Really low, about a 2 out of 10? Okay, that sounds really good. Okay, so, yeah, I don't see any edema. That's really good. The suture is well approximated. That means that it's nicely closed up. Your doctor did a great job. Okay, so, you know what? Now I would like to... We're switching to vaginal birth at this point, and I will be turning over the pillow, my patient, to be looking at her backside. Okay, so now that we finished the breast exam, I would like to take a look at your vaginal area. Just want to make sure everything is healing up nicely down there. Would that be okay right now? She says, yep, go for it. Okay, dear. So what I'm going to have you do is I'm going to move your robe aside, and I'm going to have you turn over, and I'm going to take a look at everything back there, okay? And she says, go for it. So I'm just going to flip her over. We're looking. I don't just very slight redness from the tear, some small bruising, slight swelling, but it looks like it's healing up nicely. Okay, very good. Let me just put this back down and go like that for you. Okay. Okay, so now I'd actually like to check out your stomach, your abdominal, check out your fundus. I'm going to be doing a slight fundus massage, and we're going to be checking out the discharge that may happen in your pad. Sound okay? She says yes. Okay, so now I'm opening up down here with her permission and keeping her breasts covered, keeping her as comfortable as possible. So I have opened up her underwear area. I'm checking a look at her pad. She has scant drainage already. I see that you have some scant drainage on here. And when was the last time you changed your pad? About 2 hours ago. Okay, great. So that's looking really good. Okay, so I'm just going to actually pull this a little bit underwear down and pull your pad down. And now we are going to be doing the fundus massaging. Does that sound okay? We ready? Okay. So first off, I'm going to put a hand down right here, right at the bottom of your uterus. And we're going to go right at the top at the fundus. And I'm just going to massage very lightly. Okay, and I see it's firming up very well. That's good. And you are having some slight drainage coming out. That's good though. Not big clots. Okay, how's that feel? Look good? Okay, you know what? Let me change that pad for you right now too. So I'm going to take that off, throw it away, wash my hands, change my gloves, go back to it. Clean her up, close it up. Alrighty, okay, so right now I would like to check out your extremities, and I'm just going to want to check out some signs for dehydration and other things like that. So we're just right now just want to check the tenting, which means if your skin sticks up a little, I'm going to check right here on your forehead. Tenting of 1 second, that's great. And I'm going to check your pedal pulses. Alrighty, very good. Those match your radial at 86 beats per minute. Okay, so now I just want to talk to you a little bit about your interactions with the baby and how's it going so far. Are you feeling really confident about baby? Is there any concerns you want to address right now? Okay, yes, definitely. I can see how you would be a little concerned with this being your first child. There are plenty of services that we offer here at Lake Region for new mothers, and I will make sure that you get all the information you need on that, everything from parenting classes to coping classes. There's all sorts of counseling that is available for you and dad together. So do those sound like a good thing? Sound like something you'd be interested in? Yeah? Okay, awesome. I want to make sure that I'm going to get you all of that information on that for you then. Okay, so I see that you have a good support system. Your mom was just here a little bit ago. Dad comes here as often as he can. I know he works during the day, so that's really great. Is there any other concerns you might have about lack of support or anything like that? No, your mom sounds like a great girl. She is definitely here for you. Okay. Alrighty. Okay, and so I see here that you are Catholic, and is there a priest, a specific priest or religious figure that you would like us to come visit you and speak to you for a little bit during this time? Awesome. We can have our hospital chaplain come see you as soon as they can. I know that they have a lot of other people to see, but they will definitely come see you and pray with you and talk to you during this time about your uncertainties as well. Okay. Okay. Awesome. So, if there's anything else that you need from me, just let me know. Here is your tray with your water cup. Here's your call lights. And if there's anything you need before a couple hours, just give us a shout. Otherwise, I'll come see you then. All right, thanks. Bye, Jane.